first question. My partner has performance anxiety. Is there anything I can do to help?
Performance anxiety in the bedroom is more common than people realize, and it can affect both men and women. When your partner struggles with sexual performance anxiety, it can create tension in your relationship and leave you feeling unsure of how to help. But I'd start with getting a good understanding of what's happening. This anxiety can manifest before or during sexual encounters, making it difficult for your partner to maintain an erection, become aroused, or achieve orgasm.
So you can't have an orgasm if not aroused, and you can't be aroused and have an orgasm.
Yeah, anxiety is just not good all around.
Okay.
It's the start of this bad cycle.
Talking about anxiety, is this more common for men, by the way?
Well, this condition can actually affect both men and women. It's more commonly reported in men, where it can sometimes lead to erectile dysfunction. Studies suggest that 9 to 25% of men and 6 to 16% of women experience some form of sexual performance anxiety. This anxiety can create a vicious cycle where the fear of poor performance leads to actual performance issues, reinforcing the anxiety.
You know, before I ask what the signs are to these anxiety problems, my philosophy is that men, we have a lot of pressure. We have a pressure to sustain
Not just
a
men,
family.
Derek. Not just men. Not just men.
Hold on a second. I agree, not just men.
Okay.
But for whatever reason, men think that we have to provide. We're the providers. We have to be knowledgeable in bed as well. And if we're not, where have you been? What kind of guy are you? Would you say that that might be one of the reasons, or?
Well, and I think that men just get too hyped up about it. Like, they think that they have to be like the best in bed ever. I think that a lot of women, it isn't as high on their priority list to necessarily be the best sexually. Whereas with men, it's like all about the ego. Like, I've got to be the best, But this is true of performance of anything. They actually had a study of basketball players, and basketball players that were reviewing their plays prior to going out there actually performed poorer than basketball players who just told themselves, I'm going to be great, I'm going to be amazing, I'm going to do wonderfully. And so that positive self-talk can go for the bedroom or on a basketball court.
Okay, so just transfer that from the court to the bedroom.
There you go.
Okay.
Exactly.
No halftime, no intermission, anything like that. Okay.
Well, you might need a water break. I mean, it just depends.
Some hydration.
Exactly.
What are the signs for that men might have difficulty achieving, I guess, and maintaining an erection? I mean, we know what the sign is. You don't have an erection. That's a sign.
Well, Well, some signs in men are difficulty achieving or maintaining an erection, premature ejaculation, and lack of interest in sex. For women, signs could be vaginal dryness, difficulty becoming aroused, and pain during sex. The symptoms do vary and can be easily confused with other sexual dysfunctions, but the underlying cause is psychological rather than physical.
So how can a partner or this viewer help in this case?
Well, encourage an open dialogue about the anxiety. Approach the conversation with empathy and without judgment. Let your partner know that their concerns are valid and that you're there to support them. Reassure your partner that your focus is on enjoying the experience together, not on achieving a specific outcome. Sometimes taking the pressure off can alleviate anxiety. Shift the focus from performance to intimacy. Engage in non-sexual activities that build emotional closeness, such as cuddling, talking, or spending quality time together. And don't dismiss professional help like a therapist or even medication.
I hope we're able to answer your question, viewer. I think we did. Okay. Our next question. How risky is it to have a partner that has HIV?
While HIV transmission can occur after just one exposure, the probability of transmission varies greatly depending on the circumstances. For example, anal sex carries the highest risk. Studies show it can be up to 18 times more risky than receptive vaginal sex. The presence of STIs, vaginal conditions like bacterial vaginosis, or high viral loads, particularly during acute HIV infection, can also increase the risk of transmission. For example, during acute HIV infection, the risk of transmission during receptive anal sex could be as high as 20% per exposure.
Receptive vaginal sex, receptive anal. What's the difference?
You're
why
the
is it
receiver.
receptive?
So you're the receiver. So think about like the penetrator and the receiver.
Got it. Okay, the catcher in the pitcher.
There we go.
Okay. Thank you for the explanation. If you have sex more than once, is it riskier? Is there more risk involved?
Well, yeah, repeated exposures can significantly increase the overall risk. For instance, if a woman has unprotected vaginal sex 100 times with an HIV-positive partner, her cumulative risk could be approximately 10%, and even higher if other risk factors are present.
And what can you do to reduce the risks?
Use condoms. They're highly effective when used correctly. Always use a water-based or silicone lubricant to reduce the chance of the condom slipping or breaking. There is also pre-exposure prophylaxis, or PrEP, which is a medication that can reduce the risk of HIV transmission by up to 99% when taken daily. It's particularly effective in preventing transmission through sexual activity. And then see if your partner with HIV takes antiretroviral therapy and has an undetectable load. Undetectable basically means it's untransmittable. Let's take a look what this doctor has to say.
I want people to know that it's still prevalent in society.
Dr. Stacy Rizza says HIV attacks and weakens the immune system. It destroys a type of white blood cell called CD4, which protects against infections. Dr. Rizza says most people in the early phase of the disease often don't know they have it.
It can hide away in the body in a latent state for many, many, many years, and that's why it's so difficult to cure HIV.
If you're HIV positive and unaware of your status, you can unknowingly transmit the virus to others through sexual contact or by sharing needles.
HIV prevention is using barrier protections like condom or dental dams or female condoms.
Screening for HIV can help detect the virus early, and knowing your status enables you to prevent spreading it to others.
I would love for more of society to get tested for HIV and then connect those who are infected to care so we can take care of them and give them long, long, healthy lives.
That was super interesting. Let's take another question, Dr. Lia. Is there a way to make condoms feel better for me and my partner?
One simple trick to improve sensation is to add a few drops of water-based lubricant on the inside and outside of the condom before putting it on. Most condoms come pre-lubricated, but adding a little more can enhance sensation further. Plus, there are so many options when it comes to condoms. There are different textures, different materials, so maybe try something different. You could get ridged condoms for added sensation or extremely thin ones that feel like you're almost not wearing anything at all.
That's a great tip. Before we go on to other tips, you mentioned lubrication inside the condom. Wouldn't that have a risk of slipping?
Well, if you have too much lubrication, it can. So you just want a tiny amount of lubrication on the head of the penis. Too much lubrication is also bad. That could cause a problem.
Interesting. Okay. Any other tips, Dr. Lia?
Well, have fun with putting the condom on. Sometimes the way you put on a condom can set the tone for the entire experience. Instead of viewing it as a necessary but unexciting step, incorporate it into your foreplay. For example, your partner could use their hands or even their mouth to apply the condom, turning what might be a mood killer into a sexy, intimate moment. And have a good mindset. If you're preoccupied with the worries about STIs or pregnancy, it can be difficult to fully enjoy the moment. Condoms are there to help, and if anything, you can get help to let go of some of those worries.
Condoms to the rescue.
There you go.
There's also flavored condoms
Flavored
in different
condoms.
colors.
Yeah, I mean, particularly for oral sex, because other diseases can be spread through oral sex.
That's true.
So if you want to be extra cautious and don't want to taste rubbery flavored, then you could have flavored condoms or any flavored lubricant on top of it.
Beautiful. Thank you. Our next question, Dr. Lia. What is a good age difference in a relationship?
In many cultures, heterosexual relationships where the man is older than the woman are still the norm. A 2017 study found that couples with a 1 to 3 year age difference, with a man being older, reported the highest levels of relationship satisfaction. Satisfaction tends to decline as the age gap increases. Another study from Korea found that couples with larger age gaps were more likely to experience depression, particularly when compared to same-age couples who had the lowest rates of depression. These findings suggest that in many cultures, an age gap of 1 to 3 years might be ideal. But it's important to remember that numbers don't tell the whole story of the relationship.
Our next question, Dr. Lia. How can I enjoy sex with gender dysphoria? What is gender dysphoria?
Well, gender dysphoria can just be feeling like you're not really in the right body. Right, so, and there's a wide range of various types of gender dysphoria, right? And gender dysphoria can certainly cause discomfort, anxiety, or even disconnection during sex. But know that you're not alone in this experience, and it is possible to have a good sex life that feels affirming. First of all, sex isn't one-size-fits-all experience. It doesn't have to involve certain body parts or follow any traditional scripts. You and your partner are in control to define it the way you want. It might include acts that don't focus on genitalia or involve activities like kissing, touching, or mutual masturbation.
You know, I like that you said that it's not, sex is not one size fits all, which is true. So we shouldn't have these preconceived notions that you have to be a certain way.
I think that's like one of the biggest sex and relationship killers. So whether it's heterosexual sex or homosexual sex or someone with gender dysphoria, is just presuming that you have to follow some norm. I mean, you see how many questions we get with people that are like, how often is normal to have sex, right? And it really just depends on what works for the couple.
I'm going to keep on picking your brain. What's some other tips?
Solo sex can be a good way to explore what feels good to you. It helps you understand your body and can prepare you for sex with a partner. Also use affirming language. The language you use to describe your body parts can significantly impact your sexual experience. If traditional terms cause discomfort, choose words that better align with your gender identity. There are also plenty of gender-affirming tools and toys that can be used to help you feel more connected to your body and your partner.